Hello, students. This is Dr. Johnson, and welcome to Ethical and Bioethical Issues in Nursing and Healthcare. Again, one of my favorite lectures. So just listen and don't stress too much about these lectures. Just listen to what I have to say, and of course, read your textbook. Okay. So for the objectives for this lecture, we're going to integrate some of the basic concepts of human values that are essential for ethical decision making. We're going to analyze some of the ethical theories and principles that are basis for ethical decision making, and the relationship between ethics and morality, and some of the ethical decision framework for resolving ethical problems in healthcare, and apply ethical decision-making process to specific ethical issues. So as you read your textbook, just keep be aware of these objectives. Again, I'll start with the key terms and the terms. I'm not going to read it to you guys, but you need to know them. So please make sure, read them. If you don't understand it, feel free to email me. Make sure, okay. So what is nursing ethics? Well, nursing ethics actually goes hand in hand with legal ethics. So it's kind of like some of the principles that guides the actions of the nurse when they're dealing with some issues in healthcare. It helps nurses to make decisions, especially when it comes to some of the issues that we encounter in healthcare. It's very, when you talk to some nurses, they will tell you that sometimes their burnout or some of the things that they encounter goes against some of their values that they encounter at work. So, but we have the Code of Ethics from American Nurses Association that defines our standards and values of what nursing profession should be. So again, if you're having problem with that, please go into American Nurses Association, look at Code of Ethics. You can also find an International Council of Nurses Codes for Nurses. Just Google it, you will see it. And I think on our textbook, they listed it of the Code of Ethics for Nurses and for the ICN. So you can see those in your textbook. So the interdisciplinary team, when you look at bioethics, it's the field that evolves with modern medicine to address some of the issues that we're encountering now with the age of technology when it comes to healthcare. There are so many, for instance, if you look at the dilemma when it comes to technology, like, telehealth, using artificial intelligence, some of the balancing that we have to do with abortion, things like that. There are so many things out there, even death and dying. So bioethics kind of guides that in the sense of, are we doing what we're supposed to do, and are we doing the right things? So it has to do a lot. Again, if you think about stem cell research, in vitro fertilization. So the dilemma is that the values that we hold as our own personal values are now in conflict with some of the things that are out there, manipulation of the DNA, abortion, things like that. Some nurses and doctors and other healthcare providers, they really struggle when it comes to science and morality and what it all entails. So it involves, if we look at the Code of Ethics for Nurses, it looks at, that yes, we may feel what we feel, but we have to remember we're professionals first, right? We have to have compassion, we have to have respect, we have to advocate. As nurses, we should not be like other people in the sense of looking at somebody's skin color when we're providing care, or looking at somebody's decision by judging them. We don't. When as nurses, we are not. Our Code of Ethics is saying we cannot. We have to protect our patients, their rights. They're to make decisions about their body, to provide respect in what they're going through, to be with them. without passing any judgment. And if you can't do it, then you shouldn't be a nurse. So ethical consideration is, if you have to make ethical decisions, it's like, you have to answer the difficult questions, like, is what you're doing, is it safe? Is it, what does it mean to be healthy? Is there a balance between science and or experimenting with human lives? You have to look at your own values. And that's, it's always why you have to do self-reflection. How do you feel? Are you prejudiced? Are you racist? Things like that. Look at yourself. And it's not a bad thing to look at yourself, because by looking at yourself, you'll be able to now fix yourself and move on with your profession. So always look at yourself. Do I have problem taking care of people from other cultures, other countries, other religion? And if I do, how do I quit it, right? Because you're, as a nurse, that should not, that should be in the backbone. You should even have to do that. And if you cannot, then it's not the right profession for you, because we are a profession that values everybody, notwithstanding where they come from, if they can afford care, if they smell, all that doesn't matter. They're human beings. So how do you do for value formation and moral development? Again, like I said, start by looking at your own value system, learning what is wrong and right, moving towards clarification for your value, right? Looking at what you believe in. So we have a nurse theorist. Her name is Diane Eustal. She's the first nurse leader to describe the role of value clarification for nurses. Again, it starts with like ethics, the acculturation that come with being a nurse. And that's why if you think about all the things you're learning from your freshman day, starts with introducing you to some of marginalized groups, introducing you to what nursing is all about, introducing you to some of the nursing theorists. How do they define people? What is, all those things that were prepping you for eventual of what you're supposed to do as a nurse. So her worldview is that it provides a cohesive model of life, encourages personal responsibility for living life, and it prepares you to make ethical choices. It's learning what is right and wrong. It starts with Piaget. If you guys can go back to your pediatrics, I'm sure you covered this in pediatrics, where it's like infants, when they don't have any concept of right and wrong, and then you move into children when they start learning that good behavior is rewarded, right? And then move to adolescents where they start questioning some of the moral issues and the relevance of these issues in the society. And of course, when you get moved to adulthood, where they start making sense of some of the contradictions that you might see in healthcare and of course in their personal life. So let's look at this critical thinking question. Wong is I'm sure you guys use this textbook in pediatrics. He describes learning from wrong as being based on developmental stages. At what developmental stage is a human first able to integrate the values of significant others into his or her own behavioral system? And that is toddler. At toddler, they start learning, who's mommy, who's daddy, what I can do, what I cannot do, because, mommy will not be happy, things like that. So again, I think it's Piaget is the theorist that went into detail about developmental stages when it comes to value formation. So moving towards moral maturity takes time and it takes experience. There are values that as a professional nurse you have, to establish, like altruism, where you have concern for the welfare of other people. It's not just about you, it's about the world, your patients, even colleagues. Autonomy, right to self-determination, right? Usually the nurse is respectful, they respect the patient's rights without any judgment. And then you have the human dignity, where you're respecting the inherent worth and uniqueness of people and the population. And by having respecting that human dignity, the nurse is showing empathy. They're putting themselves in the shoes of other people by showing kindness. And this goes with respectfulness of people, especially people that, the nurse may not otherwise have ever met in their life. So, when you talk about cultural congregant care, looking at people from other cultures and other religions, and even people in different socioeconomic backgrounds. And then social justice is acting in accordance with fair treatment, regardless of where this person is coming from. These nurses specialize in this because we use our integrity, our objectivity that we learn in nursing school to treat everybody as if they're kings and queens, right? So it goes into that respectfulness, the treating everybody fairly without judging them. If they're poor, rich, black, white, pink, yellow, child, adults, doesn't matter. We see human beings as human. So with ethics acculturation, the nurse is actually developing, have practical wisdom and have effective problem solving, where they're now being, if you think about cultural acculturation, they're integrating what they learn from as a nurse and as a professional to help to make as they move towards moral maturity. And that goes with the rights of consciousness, where they provide, ethical theory and ethical principles provide the nurse with the basis for moving forward as a mature professional adult. And as you start working, if you're not mature morally, you will, because your work will force, you're going to see people at their best, at their worst. And I've seen nurses break down because they've never seen, sometimes they've seen patients that they read in the textbook, they never thought that they would see in real life. Okay, with the rights of consciousness, many of us have this, as you progress in nursing, even when I've seen younger and newer nurses actually get into this, we moving towards maturity, where you develop a sense of consciousness. And this is, a matter of being in tune with what's going on around you. In this case, we're dealing with Black Lives Matter. We're dealing with people from other countries that are being discriminated against. We're dealing with Chinese Americans, or I'm sorry if I call Chinese Americans, but Americans that are being discriminated because of the COVID vaccine, because of the way they look, for the COVID illness, because of the way they look. And so nurses are actually, it's not that we don't notice these things, but we are conscious about it. And it's one of the things that we bring to debate. So for instance, abortion, many people don't want to talk about it. Nurses talk about it. Euthanasia, many people don't talk about it. We talk about it because we know how important it is to our patients, especially patients that are dead and dying, patients that want to make decisions about their body and things like that. So we take up the challenge, the debate, the lobbying to bring consciousness to other people about what's going on. So let's talk about this. A homeless person comes to the emergency department after being beaten. The nurse asks permission to remove the tattered clothing and carefully folds and places the clothing to prevent further soiling. The nurse informs the legal system that this person was assaulted and assists with securing legal representation. The nurse is at which moral developmental stage? The answer is post-conventional. So if you look back into pediatric, if you go back into the moral development in children, it will tell you that different stages of development, with the unconventional, where child has no idea what you're talking about morality, moving to pre-conventional, where they're beginning to realize this right and wrong and they can get punished, to conventional, where they're aware and they're trying to make sense of the demarcation between of what they know and what's out there, and then post-conventional, where they stand up and speak for other people and advocate for the rights of other people. So there are different types of Piaget theory when it comes to that. Okay, so with the ethical theory, you have the principles that go, explain when a person can determine what they're supposed to do and not do, right? So in nursing, it comes with the utilitarianism that is rooted in assumption that the practice or the action that we do can lead to the greatest possible good, balance of good and consequences, or to the fewest possible bad consequences. So it supports the best for most people. And so, for instance, if the government decide not to do Medicare, I think that was an example that they gave in our textbook, that of course it will affect the people that are eligible for Medicare, right? But because, if you think about during COVID, they were saying, forget the older people, they're going to die anyway. Somebody actually made that, I think it was the one of the elected official. And that was, if you think about it, the person was actually talking about utilitarianism. Of course, all of us got upset. What do you mean? Let the older people die. But the person is actually saying, let's fix the people that can still contribute to the society. Let's treat them, leave the older people. Of course, if you're looking at it from the point of view of morality, is that really right? So again, that's the approach of utilitarianism. Then you have the deontology that is rooted on the assumption that humans are rational, right? We are rational beings, and that we are very objective, and that we can do what is right, and it's consistent. Like, we can, if you give us decision to make, if you see somebody that is down, we resuscitate them, and we, if the baby is a newborn NICU baby is 23 weeks, we can vend them and keep them alive and things like that. So it helps to confirm that moral duty and what is wrong, and does it violate the moral duty, right? So every decision is made that it becomes a universal law. So those are the two principles of the two theories of ethics. Now, the ethical principles are supposed to now support those two theories. And you have, it helps to establish a common ground for everybody, and it helps people to now take consistent position with some of the issues out there, some of the morality issues we have to make. So some of these ethical principles are like beneficence, autonomy, beneficence, non-maleficence, and veracity. So again, I want you guys to know what each one is. So for instance, with your autonomy, it respects the person to make their decision, to know what is right for them. For beneficence, it promotes good, kindness, charity. This is actually one of the things that guide the society. All of us actually live by this, that you go outside, that other people have this, that they won't come and hit you or beat you or kill you, right? That's beneficence. And then you have non-maleficence, the duty not to cause harm on anybody, from injuring people and from removing harm. So again, this drives us when you're driving. Everybody knows to stop at red light, and when you're driving, not to hit the next car up next to you in the other lane, because we're following these ethical principles. And then the veracity is the principle of truth telling. Tell the truth, right? Again, in this country, we struggle with this because, if you tell the truth, they actually put you in jail, kind of, so people tend to lie. So, but it's to develop a trust between providers. So if your patient asks you, am I going to die, and they're dying, tell them the truth. Don't tell them, maybe not. No, be transparent. And of course, knowing your scope of practice. So if the patient is asking about their care, and it's not for us to tell, right? We can tell them what we can, like, yes, this is the IV you're getting, this is the med you're getting, this is what you're getting. But when it comes to their disease process, then we need to go get a doctor because they will have more information to give. So importance of telling the truth and truthfully communicating with patients and of course people around us. Okay, so the ethical making decision, again, if it's an institutional assessment procedure, you identify the ethical decision, um, or the problem, identify and analyze any other alternatives for action that will help to solve the problem, select one alternative, and then justify the selection, right? So that's how the assessment procedure. So if you're looking at identifying the problem, what ethical principles are out there? What are you struggling with? Is it abortion? And then what are the available alternatives? Not get it or have the mom have the baby and, or any assumptions out there. So, and select one alternative. So what are the factors that come together, to help you with choosing that one alternative, and then justify the reason why you're choosing the alternative. Why did you pick the one you pick, right? So what is the reason why you picked what you pick to solve the problem that you identify? And again, I keep talking about abortion because it's part of the bioethical dilemmas out there, like surrogacy, abortion, genetic screening, euthanasia, all those things. If you think about COVID, there was a time we were deciding who gets the vent, right? Who should we, because we don't have vents, so who gets it? Do we give it to the older person or give it to a younger person? So many doctors and nurses had a lot of, they had to go through this ethical decision-making model when they were making that decision. Okay, so that's the end of the class, and any questions, please email me. I will see you guys in class.